All right. So to close off our session today, I'd like to welcome Tatiana, who is involved with a multi-site randomized clinical trial that is evaluating the effectiveness of a health coaching intervention for parents of children with suspected developmental delays. This group aims to demonstrate the implementation of patient engagement strategies in this trial, and of course to evaluate both the patient engagement process and their impacts according to the perspective of both the researchers and patient partners. So welcome, Tatiana. Let me hand over the presentation to you, and you can feel free to take it away.
Thank you. All right. So welcome everyone to this session on patient engagement in the development of a coaching intervention, strategies, and perceived benefits. So I will be referring a lot to the term SPORE, which stands for Strategies for Patient-Oriented Research. CHR SPORE initiative mandates active involvement of patients and the public at all stages of research. SPORE is about engaging patients, caregivers, and families as partners in the process of research. This engagement helps to ensure that studies focus on patient-identified priorities, which ultimately leads to better outcomes. So it really refers to developing, maintaining, and I also think taking advantages in the right way from the meaningful collaborations we have between researchers and patient partners. So we have our Bright Coaching randomized clinical trial that was briefly introduced by Pierre. In this clinical trial, we're aiming to look at the efficacy of a novel health coaching intervention for parents of children with suspected or emerging developmental delays who are waiting for services. And we aim to empower parents and to improve different outcomes that are parent related. So we have a group of patient advisors or parent advisors, and those individuals are parents who have children with disabilities, and they've been engaged in different activities and tasks related to the project co-creation, implementation of our randomized clinical trial, selection of outcome measures, and planning different knowledge translation activities. So I've listed some of the example of the tasks and activities in which they were involved in the past. So of course, given the high priority of the patient engagement within our research project on Bright Coaching and the overall SPORE mandate that I've mentioned, it's important that the processes and the impacts of engagement are being evaluated. So this was basically our objective, and we wanted to look at that from the perspective of both researchers and patient partners. We speculated that the engagement actually might be challenging, given that the interactions within our project are mainly virtual as opposed to more traditional face-to-face ones, because we're involving researchers and parent advisors from across the country. Another unique feature to this project is that engagement was evaluated in the midst of the trial as opposed to more traditional end of trial evaluation. And now we can use those findings to improve our processes. And we think that it's going to have a positive impact on the end of trial results dissemination and KT activities that we're planning for the implementation phase. So to that end, we used a cross-sectional snapshot study design using mixed method approach. We surveyed our researchers and parent advisors who are members of our Bright Coaching research project by using the PEAT, or the Public and Patient Engagement Evaluation Tool. So the PEAT has 4 different sections looking at communications and supports for participation, sharing views and perspectives, and impacts and influences of the engagement initiative, as well as final thoughts and satisfaction. It's important to know that we actually have a couple of parent advisors from a group that looked at the original version of the PEAT and have provided modification by including additional questions and also modified some of the wording so that it's better suited to our population that we're studying. So they were even involved at this particular phase of the project. And we use descriptive statistics as well as thematic summaries to analyze the open-ended questions, the open-ended qualitative responses that we got from our respondents. So in terms of the descriptive statistics of both of our study group, our PAC members were predominantly female. They were biological parents to their children. All of them are married. They have a pretty high educational level. They're all employed either full or part-time, and they're being involved in our Bright Coaching project anywhere from 1 to 2 years or for more than 2 years. They have children with disabilities, with different diagnoses that you can see on the last point. The researchers are also predominantly female with about 20 years of experience in research, and 50% of our members consider themselves are regularly involved in terms of their frequency in the Bright Coaching Project. 30% are moderate in terms of frequency, and 20% are occasional. So on this slide right here, you can see the quantitative counts of the PEAT response for the first two categories of communication and supports for participation and sharing views and perspectives. We're looking at the response frequency, where higher response gets a darker color. We have purple here is for our patient advisors, and orange stands for the researcher responses. And what you want to look at is really for darker colors or high response frequencies in the column of agree and strongly agree. So this would really show a positive engagement and a positive feedback to engagement. And for example, you can see here that 75 to 100% of our parent advisors agree that we provide them with realistic deadlines in order for them to give us feedback and to review material. Similarly, in sharing views and perspective, 75 to 100% of parent advisors strongly agree that they're able to express their views freely during meetings. So similarly, for the other two sections of the PEAT on impact and influences, as well as on the final thoughts and satisfaction, you can see darker colors in columns of agreement and strong agreement, signifying high response frequency. You can see that the responses of the researchers in orange really align with those of the parent advisors. It's very encouraging, for example, to note that 75 to 100% of our research respondents strongly agree to the fact that the input provided through the PAG will make a difference to the work of the project, as well as the PAG is a really good use of time and the resources. So in terms of the qualitative responses of our parent advisors, we have two main teams that emerged, and those are facilitators, but also barriers. So in facilitators, we have a team on communication and the qualities of the research team members, which were shown to promote our engagement strategies and to have a positive impact on our project. In the barriers, we have an issue of the group being too homogeneous. So, for example, an individual here states that we're all of similar economic, race, and gender status. I don't see a lot of underserved population represented. And we have an issue, or we had an issue in the past with logistics of meetings, surveys, and management of ongoing tasks, where the person says that the amount of engagement, feedback, emails, and different requests has been increased significantly. It's a little overwhelming. The increase in the request is coming from a number of directions, often at the same time, and at some point begins to feel out of line. So this is obviously something we can work on in the future to improve. In terms of the researchers' qualitative responses, we have two teams that emerged. So one is the benefit to the project, where this particular researcher says that it really helps to inform the methodological decision so that the research component works for families, creating a coaching program that is based on the actual needs rather than on what we think the needs are. And then the quote on the impact on the professional development, I can really relate to that as a trainee for the past 2.5 years within the network. So it says that being involved in this project and witnessing the power of those interactions has made me an absolute believer in patient-oriented research. I now involve patient partners in every new project, which is really encouraging and great to witness and see. So in conclusion, we can see that most of the parent advisors were satisfied with the engagement initiatives in terms of communications and supports for participation, the ability to share views and perspectives, and the overall impacts. The responses of the research team members were found to be aligned to those of the parent advisors in nearly all elements of the engagement evaluation. And we also saw emerging benefits and strengths of our processes. Those were reported by both study groups as facilitators and positive feedback. So we're proposing a few solutions to the emerged challenges that came about through the use of the PEAT questionnaire. So to tackle the homogeneity issue, of course, we would like to recruit, and the recruitment is always open for additional members to the advisory group with diverse characteristics. And in order to tackle the management issue of the ongoing task, we propose to have a central tracking system that is visible to our researchers, where we can identify who is working on what in terms of the parent advisors and where they're at with their tasks, so that we do not overwhelm them with different things to do. Also, we want to provide them with more options for meetings and having a liaison staff gathering live feedback using an online interactive platform instead of sending them surveys if this is what the parent advisor prefers. So what I want to leave you with is a really helpful strategies, those that were used by our team that may underline the positive feedback that we've got. I think it's very relevant, especially now in this time of the pandemic that we're living in. Maybe if you're involving patient partners in your project, or you think of involving them, you might want to do this virtually now that we're dealing with those issues. So I want to tell you what worked best for us, because we've been doing this for a couple of years now, so having those virtual connections. So first, we allow and plan for the members of the PAC to meet separately from researchers, and this facilitates and optimizes their discussions and the brainstorming activities that they have. We know that meeting separately for them helps to minimize their fears of feeling intimidated, for example, during meetings, because discussions that include researchers often use academic jargon. We cannot help it, we just talk in this way. We also offer our members of the PAC a secure online platform for their meetings, so they really can discuss issues and work together in a safe place. Those issues and requests are regularly brought back to the team, and they're accounted for once they're addressed, every single one of them. And we also have periodic interactions between our parent advisors and the research team. For example, we do send them updates even when a lot is not going on. We invite them to different activities. And of course, a very important act that we do is that we highlight our appreciation for the wonderful work that they've been doing and for the wonderful input that they always had towards the project. So I'm leaving you with this, and also with my email address. If you do not have a lot of time right now to discuss either the strategies or the results that we have, you can always reach out to me, and I will be happy to reply and discuss those with you. And on the last note, I wish everyone to be healthy and to stay safe during this period. Thank you.
Wonderful. Thank you, Tatiana, for sharing the successes and challenges that you have faced with incorporating patient engagement efforts within the project. It sounds terrific of how you've adapted and how you've made it more accessible to enhance those engagement strategies. So again, to the audience, please, if you have any questions, feel free to upload them on our online platform. I'm cognizant of the time, so thank you for still being around here with us. So we'll try to take one or two, and then we will wrap the session up. So a question we have for you, Tatiana, is what interactive platforms are you considering for tracking and interacting with your teams?
Yeah. So I think that right now our parent advisors are using a separate Zoom account that they have for themselves, or a GoToMeeting account. I think in the beginning they were using GoToMeetings and then they switched to Zoom. So this is what in terms of they're using to interact between them. When we have virtual meetings, we also use Zoom or GoToMeetings. And now we're looking into creating that database or a platform where we can show the activities of our parent advisors and also track their progress, so that we do not overwhelm them all at the same time. So we're looking at a sort of a database that we can create and use, that it would be visible for our research team members, but I do not have a direct answer to that particular platform yet.
Okay, well, I think that's a terrific initiative, and definitely when you do develop or do adapt one, I think it would be great to check in with you again and see how that's working and how it's made a difference. One other quick question, I guess, from my end, is that in your presentation, you provided some feedback that indicated that at times the workload doesn't really align well with that at the particular level of compensation that patient partners receive. Do you have any suggestions on how that gap can be better bridged?
Well, I think that CHR actually has very clear directives on compensation to the parent advisors. However, I think that parent advisors should feel safe reporting when they feel overwhelmed and when they feel that it's out of line for them, like for example how this particular person did it. So we, as a team, maybe this could be assessed and we can see if the compensation can be modified or changed. But I definitely feel that the relationship and the communication that you're establishing with the parent advisors, they should feel safe and open to discuss those issues with you and report when they are being overwhelmed with tasks to do, definitely. So I'm actually happy to see this comment. I'm happy that this parent advisor reported that, because this shows that they feel comfortable enough and confident enough to tell us about this.
Great, thank you. Yeah, and just underscores again that idea of having open and transparent communication to allow the group to be more effective in working together. So yeah, thank you so much for sharing your work today, Tatiana.
Thank you.
All right, so that brings us to the end of our third session for our 2020 Child Right Virtual Symposium. Thank you all for attending, and of course a special thank you to all of our presenters that showcased their work today. If you have not done so already, but are interested in attending the next session, which is next Thursday on May 28th, please be sure to register by visiting the events page on the Child Right website. We will shortly follow up with you to request any input that you may have or wish to share about today's session, as well as any changes you think would be useful to incorporate in any future iteration of this that we do host. And lastly, of course, if you have any questions or about the sessions or about the presentations, please don't hesitate to connect with me with the email address that is displayed. So once again, thank you so much for joining us. Enjoy your weekend, and we look forward to connecting again with you next week. Take care. Bye.